Hello everyone, Dr. Luis Anderson once again. As I told you in the previous video, today we're placing a Megagen implant. So let's begin. As you can see, we have already placed the crown or wax up. I already showed you how to put it, and another video explains the extraction feature of this deciduous molar KCT. First, we need to select mode implant, located right below for the mandible implants and on top for the upper maxillary implants. Once placed, we need to remember to unlock and select all if you wish to edit the implant. Therefore, let's access the implant section by just right-clicking the implant, which can be on top of the rendering or the gray images as well. So now let's talk about the treatment plan. This preoperative CBCT showed narrower bone width considering the relationship with the opposing tooth. However, placing a wide diameter implant would require a large amount of bone graft. Thus, considering the patient's deciduous molar minimally invasive surgery with placement of a 4.1 BlueDiamond implant is decided on. By referring to the Dental Implant Prosthetics book by Dr. Carl Mesh, when the mesiodistal space in the posterior regions is to 8 to 12 millimeters, a 5 to 6 millimeter implant is suggested. However, with Megagen BlueDiamond implants that are very strong to avoid fractures due to its fantastic elaboration, and since have been tested from occlusal forces, we can place narrower implants like the 4.1 diameter implant, since we know is strong enough. As a key point, we need to know if a wide diameter implant is placed in the posterior region with narrow available bone to bear the load, extensive GBR is required to obtain at least 1.5 millimeters of buccal bone to support the implant. However, some patients require minimally invasive surgery due to advanced age or systematic disease, etc., and this is such a case. It is possible to secure sufficient buccal bone with a minimally invasive bone graft procedure by placing a small diameter, high-strength BlueDiamond implant due to its structural and mechanical design. Here are important shortcuts for implant movement. We use the A key for moving the implant distally, D mesially, W crestally, and S apically. Q and E moving the implant counterclockwise and clockwise respectively. Here is the implant safety zone in which we can ensure that we're taking good care of the patient's critical structures. Here's the primary feature of Artugate Digital Eye. We can see the cortical bone represented in yellow and blue. It's noticed that the cancellous bone is encased by cortical bone. Additionally, we can also measure the mesiodistal distance between the implant and the adjacent teeth, which in this case is the second or first premolar, since one premolar is missing in this patient's CT. As we know, we need a minimum distance between the adjacent teeth and implants of 1.5 millimeters. In this case, we have around 4 millimeters per side. Thank you very much. See you in the next video.